In the world of medicine, we're constantly searching for groundbreaking treatments and breakthroughs. Now, Stanford University scientists are hopeful their research will soon lead to a cure for some cancers. A new cancer treatment has wiped out all of the tumors in a group of mice, according to scientists at Stanford University's School of Medicine. They hope these experiments lead to a vaccine that could quickly and inexpensively cure people suffering from cancer. The treatment contains 2 immune-stimulating agents that were injected into the tumors, curing 87 of the 90 mice. The next step is a small trial with 15 people who have been diagnosed with low-grade lymphoma. Oncologist Dr. Lawrence Pirro joins us to discuss, because anytime you hear a headline like this or a study, you get really excited because people hear hope. What's the latest with this?
Well, Travis, this is a very interesting study because it falls within a bigger area of excitement. We're in a revolution in immunotherapy for cancer. So imagine a city being attacked at night. And on every street corner, there's 2 or 3 warriors, 2 or 3, army people or whatever, who could actually defend the city, but they can't see the invader. So the city is being pummeled. Now, suddenly you give those soldiers a pair of night vision glasses, they can see the invaders, and in a matter of minutes, they wipe them out. That's what's going on here. In all of our tumors, we have T cells that are our body's own immune warriors that are sitting resident in the cancer. They're sitting actually in the tumor, but they can't tell that the tumor is supposed to be killed. And so we're learning techniques, and this is one of them, of how to empower those T cells to now see the cancer and kill it. What's incredible about this is they're injecting this vaccine directly into the tumor, one tumor site, and empowering those T cells to now attack that tumor, and some of those T cells migrate out of the tumor and find the tumors elsewhere in the body and kill those tumors as well.
Game changer, potential game changer.
Because I think that the data was 87 out of 90 mice were cleared, but even the 3 who didn't clear, when they had recurrences, this worked the second time around, correct?
Exactly. The second vaccination took care of it again. And what's truly interesting about that is that the other immunotherapies that we have now, it's a very dangerous thing if you think about it, turning on the immune system, because your immune system is doing a lot of things. It's fighting bacteria, it's surveying your body to make sure everything's right. And there's lots of diseases that come from the immune system going awry, right? Rheumatoid arthritis, lupus, ulcerative colitis, all that. Well, one of the problems if you turn the immune system on generally, then you may get the immune system attacking your own body. And that happens with some of the treatments we have now, the treatments that we call PD-1 treatments or PD-L1 treatments, whereas here we're selectively injecting the tumor. So it's a very precise process, and it may help to avoid the side effects that are coming with other
and not to mention,
therapies.
When you traditionally treat cancers with chemotherapy or radiation, using your warrior analogy, you might need to detonate a bomb to get rid of the bad guys, and in so doing destroy half of your village, destroy your body in trying to kill off the invading cancer cells. But this would potentially improve treatment so much that all those untoward side effects that so many people suffer through with cancer treatments, they wouldn't be there.
That's exactly right. But here's the thing, is that right now, just right now today in America, without some of these things, we spend $32 billion a year on cancer drugs. A cancer patient is twice as likely to have to declare bankruptcy as any other citizen, right? I mean, that's a very sad reality of present. But when I say $32 billion, I'm talking about just the expenditure on drugs. I'm not talking about hospitalizations and all the other pieces of it. And so you can imagine treatments that are costing $375,000, $475,000 for a treatment, that number is going to go up, very quickly. So this particular treatment, if it pans out and is successful in people, and as we said, a human trial has begun in lymphoma, this has the possibility of dramatically reducing the cost, because it doesn't have to be customized for each individual patient, and it doesn't have to have these long processing times. So if cost could be reduced dramatically, then that gives us not only hope for patients, but it gives us hope for society.
Could a simple saliva test have the power to help prevent cancer? Join us with more insight into this new age of preventative medicine is board-certified oncologist, our friend Dr. Lawrence Pirro. Doc, great to have you back.
Thank you. Great to be back. Thank you.
And this is really important for everyone to pay attention to because we've heard of these at-home DNA tests for ancestry, for overall health. But let's talk about DNA testing to prevent cancer?
38% of people in their lifetime will get cancer. So it's on all of our minds, right? And we're all trying to be fit, lose weight, eat well, eat a lot of antioxidants. But if you could know what genes are working against you, then that may help you, providing there's something that you can do about it. And there lies the conundrum, is it's worth testing if you can do something about it, but it may also be worth testing so that you know what you might be passing on to your children, right?
But what I think is so interesting is that we've had the ability to test for genes that predispose to cancer in a clinical setting for a long time. But this new twist is the ability to do it at home, where you may not have the medical knowledge to then interpret your result in a meaningful way. How do you feel about the at-home aspect of this?
Well, there's several features. The at-home piece is possible because it's been made inexpensive. It's really a technological advance of techniques that allow you to screen a large number of genes fairly cost effectively, like in the $150 to $200 range. Prior to that, it may have cost thousands of dollars to screen these genes. And so most people, $1,000 or $2,000 is out of reach, but a few $100s may be within reach. The downside is it's going to be very hard to interpret the information by yourself. And I would advise not to use a test unless the makers of the test provide genetic counseling as a part of it, or you have a doctor who can help you with that, or both.
I think that's great advice. So I'm thinking about this now as a parent. I'm wondering, what is my obligation to them now that these tests are available? What kind of testing should I be pursuing? And then how do I counsel them as to what to expect?
This is really one of the trickiest things in contemporary medicine, because it doesn't just involve science and medicine. It involves philosophy, religion, and most important, your psychological structure. God knows we're living in a time period where a lot of people are neurotic, and there's a lot of things to be neurotic about, right? And so you really have to balance who you are as a person. Is information empowerment for you, or is information really a burden for you? Now, it turns out there are cancer genes that give you an increased risk for cancer. So for your own health, it's not a bad idea, especially if you have a family history. I mean, that's the best way to start. And traditionally, if you have a family history of a lot of cancers, of different cancers, then that's a strong reason to test. If you have no family history at all, it doesn't mean you may not have a gene for cancer, but there's less of a reason to test, but you still probably should test. In terms of the children, in general, I think it's nice to know what you're passing on, but especially important in that category would be those genes that give rise to cancers in the childhood years. And there are mainly two of those. One is a mutation in something called P53, that gene which causes a syndrome called Leaf-Romani, where it's associated with a lot of different cancers and a very, very high risk of cancer. In men, probably about a 73% risk of cancer overall. In women, 100% risk of cancer overall. Pretty significant. And then the other one, which is familial adenomatous polyposis, a gene defect which causes you to have lots of polyps in your colon, like sometimes thousands, and a pretty much 100% chance in your lifetime that you will get colon cancer. And in that case, we remove the colon in advance at a certain time period in their history. So those two are kind of important because those are things that occur in the childhood years. Most of the rest of the things are going to manifest after 18 or 19 or 20, in which the child could be tested themselves depending on the situation.
I think that is going to ultimately be revolutionary.
Or warn your doctor about a reaction you might have to a drug before it's prescribed.
The opportunities here are simply enormous.
We're closer than you think.
This stuff's here.
Your genome and the future of medicine, tailored to fit you. But there's another side to personalized medicine that's equally important, and that's controlling adverse drug reactions.
Right now in this country, more than 125,000 people die each year in America's hospitals from adverse drug events. It's the 5th leading cause of death in America's hospitals.
The DNA is the master molecule that tells the body how to work. It's the set of master instructions. In the instruction set, there's these 4 letters, and it turns out for each one of us, there are about 3 billion of those, and they're strung together end to end. It turns out that 99% of the building blocks are all the same. 1% of them are different. But it's that 1% differences that make us different human beings.
It's also why a medication may work in one person, but have no effect in another.
We have drugs for breast cancer, and yet 40,000 women die of breast cancer every year in the United States, and an equal number of men die of prostate cancer. If we go back to what I call the Neolithic era, when I was starting to do this kind of research, and we see the changes that have already occurred, it is mind-boggling. The way we've been used to doing things, seemingly forever, but at least for the past 50 years, is going to change, and it's going to change very rapidly.
We realized early on that this was a really important opportunity for Mayo to be able to offer to its patients. The ability to reduce side effects, to choose the right drug and deliver it at the right time. Dr. Wischenbaum is probably the person that is most responsible for starting this field in the entire world.
He is the founding father of pharmacogenomics, that particular area which we look at the genetic and the genetic contribution to drug response.
Respond to the drugs that doctors prescribe for you. When I was in medical school at the University of Kansas, if we saw a child with acute lymphoblastic leukemia of childhood, the #1 cancer of kids, tragically, that child would be dead in 1 year. There was really nothing we could do for them. Today, 90% of the children with leukemia of childhood are cured today by the use of drugs. Not radiation, not surgery, by the use of drugs.
Most people who receive Plavix as an antiplatelet therapy do well, but 20% of us do not metabolize the drug, and therefore it doesn't work. We'll start seeing that newborns get their whole genome sequenced, and that genome is stored and then used as needed.
We'll know the genotypes that is the DNA sequence variations for all of the genes that encode proteins that either metabolize drugs, transport drugs, or are targets for drugs, so that if a doctor writes a prescription for codeine in the future, which codeine is still a fine drug for some people, then immediately the electronic medical record will recognize that this patient we already know in the electronic medical record that this patient has multiple copies of CYP2D6, the gene that makes codeine into morphine, and will send an alert to the physician, your patient might be at risk. Do you want to use this drug? Do you want to select an alternative drug, or do you want to change the dose of the drug? It'll be amazing, but it's going to be disruptive. And wonderfully so, because we need to prevent disease, not treat it.
Hello and welcome to Health Talk. I'm Rick Leventhal, sitting in for Dr. Manny. Personalized medicine used to be a thing of the future, but the future is here. Doctors are now using a new technique to prescribe more effective medicines for chronic pain. Joining me now is Dr. Anita Gupta. She's an anesthesiologist and pain specialist at Drexel University College of Medicine. Thanks so much for coming.
My pleasure.
So how does personalized genetic testing work in your practice?
So as you know, we're all made very differently genetically. And these differences that we have genetically actually influence how we respond to medications. So what I have is actually a test that may predict a patient's response to these medications. For example, one patient I give one medication, they may actually have a wonderful benefit, and then the same medication in a different patient, they may actually have a severe adverse event.
So what is the test? How does it work?
So essentially, an individual, if they need to have the test done, and if they're an appropriate candidate for it, they're given a sample of their saliva. That saliva is sampled by a laboratory, and then a result is sent back to the physician who ordered the test. Essentially, I'm able to do this test on the first visit, prescribe them a medication once I receive the results, and really personalize their medication regimen, and oftentimes I get benefit, which is a challenge for most of my patients. And certainly that that test that we do for them, they take that information to other providers, primary care specialists. They can use it to maybe help them with other conditions such as heart disease, cancer.
This is going to shock you. It will blow your mind. Yeah. The big message is the cost of doing a DNA profile has gone from several $100,000, being impossible, frankly, 10 years ago, to now being $1,000. For $1,000, if I know everything about your genome and I can begin to pick out exactly where your weaknesses are.
You can match a blood transfusion to a blood type. What if matching a cancer cure to our genetic code was just as easy, just as standard? And that's the promise of precision medicine, delivering the right treatments at the right time, every time, to the right person.
Your genome and the future of medicine, tailored to fit you.